Cool, right? But I tell you, when I get a chance to speak to nurses and when I get a chance to speak to midwife, I'm in my perfect ecosystem. So I bring you greetings from the United States, and I am so, thank you, my sister. And I'm so glad to be in Accra, but most importantly, I'm glad to be with you. Nursing has never left me. Once a nurse, always a nurse. And I think I'm an okay lawyer, but I was an amazing midwife. I could challenge any of you guys to the perfect delivery right now. It can go down right here in Accra, right? But I want to thank you for the work you do. You're the guardians of our society because you're the ones who help to bring life into the world. That's where it begins, right? And so when I think about you, and we all do, as really very, very special, right? So a lot of times the conditions under which you work does not seem to suggest that you're important, but never lose the sense of being important in terms of what you do. And on your hardest days, remember you're special. And remember that your patient, the mothers and the family, they depend on you. And they're holding on to you for dear life, right? So one of the things I wanted to go back to reset some of the conversations we have. And that is today I'm going to be speaking about compassionate nursing care. Because every once in a while, we need to be reminded. Every once in a while, we need to remind our colleagues. And in the days when it gets really, really tough, there's one thing you can't lose, and it's your compassion, right? And some of us, we're like born with it. We're very empathetic, and some people, we have to build it into their system. But the day you decided you wanted to be a nurse, and the day you decided to be a midwife, that is where your compassion has to kick in. Because no matter what's going on that day, the mother that's in front of you, she is relying on you to be nice. So first of all, what is compassionate nursing care? It is a caring, it is a sustaining approach to how you take care of your patients. It's a very holistic approach. It's looking at your patients and understand that no matter where they come from, no matter what ethnic tribe they are, no matter whether they're rich, poor, homeless, it doesn't matter. It doesn't matter if this is their sixth child or their first child. It doesn't matter. It doesn't matter if they have antenatal care or not. This woman is in front of you and she is in labor. This is the time you're going to make her feel very, very, very special. Attitude is energy, right? I come from Jamaica, and there's a culture when we have pain to verbalize that pain, right? And when I say verbalize it, I mean yell and scream, and you're like, tell me, why are you screaming so much? Where's hurting you? And they can't even get to articulate it because they have to get it out vocally. Is that the same thing here in Ghana? It depends. It depends on the grouping. Right, yeah. Yes.
They don't exhibit the pain.
Right.
That is through gestures or maybe non-verbal
Right.
cues that you'll be able to find out that they are in pain. But with the soundness, they express it.
Yeah.
Yelling or maybe.
So you hear that, right? And what happens a lot when you're in a labor situation and you have a group of yelling mothers, everything is chaotic. That's when you have to go within and you have to breathe. And you have to remind yourself that This is your ward. You're in charge. And you have to understand, like she told us, that based on where your mothers come from, they may exhibit pain differently. Now, the one that does not yell, but holds it in and is very stoic, may be your problem patient, because she could be holding it in so much that the next thing you know, the head is crowning, right? Because she didn't show it. Or she's in trouble and you don't know. She could be in big pain and she has a placenta previa. But you don't know because she did not show the pain. So do not show deference to the mother that does not yell, right? Because you think, oh, she's really special. She could be your problem person as well. So what we do in compassionate care, each patient is an individual. And every time you see her, because if you've been a midwife for a long, long time, you've seen her more than once. Every time you see her, you restart the clock. Because you don't know what has happened in her life since the last time you saw her. Her mother could have died. One of her children could have died. Her husband could have lost his job. Just so much. She could have a husband at home that's very, very ill. You don't know. So when you see her, first of all, you're going to recognize her. Because it's the worst thing that a patient you've seen over and over, and she comes in and you act as if you don't know her. You know, I mean, patients will say to you, nurse, don't you remember me? And sometimes you've seen so many, you really don't, right? But they expect you to remember them. And they're going to repeat the stories that you have. And the older you get, the less likely you're going to remember. But you have to find a way to bridge the gap. Because if you lose that first battle, which is at the introduction, it's hard to recover. So under compassionate care, each patient is an individual. Each visit is a fresh visit. And when I say each visit, I mean when she comes to deliver. But before you see her antenatally, before you start going to her condition, you want to talk to her. So let me ask you, how do you greet your patients? I want some volunteers. How do you greet your patients? This is interactive, I forgot to tell you. How do you greet your patients?
Okay, so perhaps you've seen her before, so you might know her name.
Right.
Before she comes to you in the room, antenatal group is already with you, so you call her by name.
Call her by name?
Yes.
Yes.
If it's the first time, you don't remember her name, and you don't know her name, so you make a formal introduction.
Right.
Mention your name, I'm midwife Charlotte, and what's your name? So
Right.
start from there.
Right. Always 2 introductions have to go forth. Thank you. You have to tell her, because you're wearing a uniform, doesn't know she knows you're a midwife. You could be everything and anything. So you have to, I am Charlotte, and I'm going to be your midwife today. Or if you're going to be the midwife that's going to take care of her all the time, you want to let her, I am going to be your midwife. Nice to meet you. What is your name? You don't look at the chart yet. You ask, where are you from? You know, don't ask her how many children she's had because it's in the chart. And she's going to be like, I can't believe this. She doesn't know how many children. So don't ask her things that's in the medical chart yet. You're going to verify the information. But you want to develop rapport. How are you? How did you get here? Who drove you here? Did you take the bus? How was it? You had breakfast. Build rapport. And always look her in the eye. Always look your mom's in the eye. That tells her what? I see you. And when you're looking in her in the eye, I see you I see you as a person. I had a doctor taking care of me where I come from, and She never looked at me. I'm like, this is interesting. She looked at my lab work. She looked at my chart. COVID was come and gone. She was still wearing her mask. She sat down and she didn't look at me and she read all my lab works and all like that. And because she never touched me, she misdiagnosed me. She thought I had arthritis. She thought I had rheumatoid arthritis. I'm putting my business on. She thought I had rheumatoid arthritis. I had Sjogren's. If she had touched my hand, she would have seen it. If she had asked me to stretch out my tongue, I have the classic Sjogren's tongue, which is little cracks in things. That's why I can't be eating all your spicy foods, right? It burns my tongue. It's there. So she diagnosed me with rheumatoid arthritis. Thank goodness I was not going to take any medication because I wasn't going to take any medication. I just needed to know the diagnosis. But I kept looking at my hands. Look, I'm like, I don't have rheumatoid. If not, I really have it under control. So I went to somebody else and he said, you don't have rheumatoid, you have Sjogren's. And that's important because that means that my salivary glands are dry, right? Which explains why I was eating my food and it was not going down because I don't have any saliva, right? And I noticed that a couple of times people said, excuse me, you have something on your teeth. I don't have any saliva to move the lettuce off my teeth, right? So I needed to know that. So I drink water, right? If I'm out in public eating, I'm always going to drink water and without you seeing, try to get it around my mouth because just in case there's something sticking to my teeth. The reason why that happened is because she never looked at me. So I called and told her, tell her if she no longer wants to be a doctor, she should leave the profession because she has to touch me and she has to look at me, right? So look your patient in the eye. That's number one. Call her by her name, right? And don't be fiddling with the chart and call her by her name. You're looking to find the name, right? You can literally say, listen, what's your name? Again, or if you forget. You see a lot of patients, if you forget, tell her you've forgotten her name. Forgive you, I've forgotten your name. What is your name again? And make it like a joke. For me, it is at my age, I forget everybody's name. Everybody's name, so that's not a problem to tell you. What's your name again? That's sort of and it's usually at my age, my excuses at my age. I forget your name, right? So make sure that you name and look her in the eye. The next thing, like we say, don't just jump into the medical record. See her as a patient, a little something, something, something. It could be the same story you heard the time before, right? Look like you're interested. Look like you're hearing it for the first time. And the truth is, if you like people, everything they tell you will be interesting. So if you're in this profession called nursing, my students, you have to like people, like for real. If you don't, this is a good time to stop being a nurse. I am serious. You really, really have to like people. I like people. I talk to everybody. And by the time I'm done, the person who takes my bag in, I know everything about him and her because I find people interesting. You have to develop that sense of interest in human beings. It also means that by looking at her, you can tell, you can get the message about what she's not telling you. Because most people, when they come to the hospital, try to be on their best behavior, right? And they're going to put the best forward. If she's in an abusive situation, she's perhaps going to put the best forward. But you are going to look at her and you're like, something is not right here. I know what she's telling me, but something is not right here. And as nurses, and when I say nurses, I mean midwife, your gut. As you get more and more into this profession, your gut is going to be telling you that something is not right. It could be that she's hungry. It could be that there's very little to eat at home. And when there's very little to eat at home, who goes without? The mother. She feeds her kids first, she's going to feed her husband, and she will go without. So you've got to look at her, and you have to, the next you got to hear. You hear with your ears, and you hear with your gut. Compassion makes you look at the person as a whole. And your senses will tell you more than the words coming out of her mouth. Look, hear, but to hear, you have to listen. I know the clinic is filled of people. I know that you got to move them on, but you have to listen. Because if you don't listen, you're going to miss important details. And you cannot be writing, if you're going to be writing, if she's going to be speaking to you and you're writing, you got to tell her what you're doing. Tell her, listen, I may not be looking at you, but I'm hearing you. I want to write down in your chart so the next time you come, I don't have to be asking you or explaining you. Or this is very important for what you're telling me. It's very important for me to have in your chart. So the fact that I'm looking down is not because I'm not paying attention. I'm hearing everything. You could even repeat the last thing she said to you to reassure her that you are indeed listening. So you've got to listen and you've got to clarify. Sometimes you have to repeat what she said to you to be sure. Don't try and figure it out. Don't fill in the gaps. Sometimes people are telling you a story about their health and they're missing pieces because they didn't think it was important. You want her to know that, tell me everything. Let me decide whether or not it's important or not. So she had a little bit of spotting, but that was 2 weeks ago. It doesn't happen it's not happening now. And you ask her, is there something that you're concerned with now? And she says, no, because it's not happening now, because that's what you said, right? You need to say, okay, now, but since you need to start from the last time they were here, and then you can say now, because you have to cover a period of time, because you might miss a lot from the period of time. But you can only do that if you are listening and talking to her, paying attention and all like that. Always sit until you're taking care of her. When you sit, you put both of you on the same level. So there's not a hierarchy. When you stand, don't you hate people talking to you and stand over you? Right? Don't stand over your patients like whatever. And if they come in and it's a short visit, don't let them stand up. Find a way for them to sit, right? Invite them to sit, because sometimes they don't know whether they're to stand or sit. Say, please have a seat, right? Even if both of you have to sit on the bed to get there, on the stretcher to whatever you have in your clinic, sit with her and have proximity. The further you are from your patient, the more distance you're going to create, and distance creates disconnect, and distance does not allow bonding. All right, okay, perfect. Yes, distance does, I see me, it's all right. So next slide, please. Okay. Distance does not allow, touch your patient. There's nothing more important than touching your patient, right? It says, I'm human, I'm not afraid of you. And if you're not doing something that needs for you to wear a glove, do not wear a glove touching your patient. Touch your patient. It's the patient, if you don't do that, the patient is going to feel that you think they're going to you're going to give them, they're going to give you some disease, or you think you're better than. Touch your patients. By now, as nurses and students, you need to know touch is powerful. Touch is healing. So the screaming person, touch her. Touch her. And remember, they might not have come to antenatal clinic, so they don't know anything about the breathing, right? So she's yelling, screaming, and said, listen, I need to talk to you about something, but you're giving me a headache. Hold on a minute, hold on a minute. And then you might say to her, listen, I want you to hold your breath. We're both going to hold our breath for a while. That is to stop her from screaming, right? There may be nothing about holding your breath, right? It's very important. You make it important. It's very important for you to hold your breath because you're trying to tell her to stop. She cannot hear you to stop. All right, so those of you who've just come in, what is compassionate care? Being present with empathy and not just action. Offer kindness in time of loss or fear. Respect every mother, every baby, every family. Listen, hold hand. Holding hand shows humanity. We are nurses. We're in the humanity business, right? You've got to go. We've got to get back to it. A lot of times because of circumstances and how hard it is and whatever, there are days we forget. But that should not be a permanent state. Sometimes when you're losing it, you need to hold your breath. Or you need to say to your colleague, can you just watch this patient for me a moment? And step out and gather yourself. Because you cannot afford to lose it when there's a mother in front of you and a family depending on you. And you want to, because when you lose it, you're going to miss things. And as you know, as midwife, a perfect normal delivery can turn on a dime. Right? Everything was fine, and all of a sudden you're like, what is that? That is blood. Right? She's already delivered. You checked her fundus. It's tight as a rock. You turn around and you're like, that is red. That is blood. It relaxes on you, right? Especially when there are multiple births. You have to assume with multiple birth that the uterus perhaps going to relax on you, right? So you got to keep an eye on that uterus. Multiple birth is going to mess you up every time. They're going to deliver good. They're going to deliver fast. They know the way to do it. But what's going to mess you up is that postpartum hemorrhage relaxes on you in the perfect situation. So as you get more experience, that is something you're going to keep an eye on, right? You're there writing up a chart and you're looking at a dead patient because she just bled out and you're in the room, right? So, and you know where you practice, maybe there's no blood. Do not let her bleed. Repeat up. Tell her, don't let her patient bleed on her. Tell her. If not, you too, do not let your patient bleed on you because you're dead in the water, right? The reality, there's no blood. There's no blood bag coming. There's no ambulance coming to take the patient. Do not let your patient bleed on you. Are you guys giving misoprostol out in after delivery? Yeah. Not routine. At least, yeah. Because the World Health says that the woman can self-administer misoprostol herself. All she has to do is check her belly to make sure there's not another baby there. And technically, the mother can, in the Congo, in the bush, we gave it to them to administer themselves. They had traditional birth attendants. Put it on there. What's going to go on? Nothing's going to happen. Even when somebody gave it and there was another baby in, nothing happened. But at least, nothing happened. Thank you, Jesus. Nothing happened. But at least they didn't bleed out on you, right? Because that is the bane of your existence. If they start bleed, I hope you're praying midwife, because it's you and Jesus, right? That sort of thing. So that is why you have to presuppose certain things. And like you say, standardly you're giving misoprostol to multiple birth because you're anticipating. All you young midwives, you hear that? You need to figure this out. You have to anticipate. You see, she's touching the mother. You see her face, whatever is going on, whatever it is, something nice is not going on. But look at how relaxed the midwife's face is, right? Her hand, and she is at the same level as the mother. And she's physically not only touching with her hands, but shoulder to shoulder, she's touching. That is if I ask you to describe that picture, you'd say that is comforting. We don't know what was going on. She's clearly in distress, but that is a comforting posture. There is, once a midwife, always a midwife. And there are days when you're at your best, and there are days which are fun when you're not at your best. That's just life in the fast lane. But you should have more good days than bad days, right? All right, so we can go on to the next slide, please. There are challenges facing Ghana or any low-resource countries. I can't fix it. I live in America. I can't fix it, right? And you might not be able to fix it at the level. I know that you're fighting for things, and you should continue to fight, because you're the guardians of what needs to happen. The mother can't leave the village to come and talk to the Minister of Health. You can, right? But here's it, and you're like, we talk to them, they don't listen to me. That's okay, talk again. What needs, every 90 seconds, a woman dies from complication of pregnancy. So since we've been here, a lot of women have died. Where do you think most of those deaths happen? Sub-Saharan Africa. That's why I am here. Most of the deaths happen in Sub-Saharan Africa. What are the causes of death? What are the number one cause? Bleeding, postpartum bleeding, preeclampsia, infection, right? I mean, those are your top three, right? We haven't even got to chronic diseases yet. The last figure I saw for Ghana, you're doing great on the Millennium Development Goals. You guys came down quite a bit, but you're not there yet. And so not only me, we are going to have to do something about it. You're about 247 deaths per every 100,000 live births. That's too high. Period. Even one death is too much, right? Right. So, for example, there's a country in the world that no mother so far has ever died giving birth. Anybody have any idea? Which country might that be? I'm gonna stay here until somebody give a country. It don't matter. It ain't in Sub-Saharan Africa. That's a clue. So, what do you think there may be? Say Canada. That's a good guess. She said Canada. You're getting close. In Europe. It's Norway. Norway has 0 deaths. Norway. Switzerland has 1.2. America, we don't do so good. We're the worst of the developed world. We have 18. A country that Jamaica has 133. So more or less in terms of economy, not in terms of population, but in terms of economy, Jamaica is kind of like yours. It's a third world country. It's a developing country, right? They can perhaps control it a bit better because they have 3-point-something million people, right? So you can wrap your hands around the problem. You can always find a way to get an ambulance or somebody to a hospital because it's 3-point-something million people. You have maybe about 38 million, 30 million people, so that's a whole different conversation. But Rwanda has a lower thing, right? So we have a long ways to go because even one death is too much, period. The way we're going to fix that is to have a champion. One person who says, not on my watch. It could be in the government. But if it's not in the government, it's going to be you. It's going to be one of you. You stand on the shoulders of greatness. One person can make a difference. The last time I was here, I talked about it. And I mentioned Wangari Maathai. She is Kenyan, Dr. Wangari Maathai. She started what's called the Green Belt Movement. She walked around Kenya planting trees. She planted millions of trees in Kenya. One woman. So in Somaliland, there's a woman called Edna Adan. She has the Edna Adan University, and she is training midwives as fast as she can. I've been to Somaliland to speak for Edna Adan, right? So you have one person, you have Lema Bowie out of Liberia. As a result of her, one woman who kept having the same dream, that's how the regime changed from Charles Taylor to Shirley Johnson. One woman. So back to you all. We need a champion in Ghana that's going to say, not on my watch. You don't have to have resources to do that. You don't have to know the end result. You just have to have the heart for it. And little by little, lives will change. And little by little, more and more people will come to understand what you're talking about. So, I know you have lack of equipment. I know you have no oxygen. I know that. Out in the community, you do not have oxygen. You've not seen an oxygen tank in your community, in your clinic, from the day you graduated nursing school and went there. It's not there. So you have to figure a way. I mean, I don't know how you do it when oxygen is what you need, so that I'm going to leave it alone. We can talk about that later, right? You don't have monitoring. How do you charge your labor? You guys use the pathograph?
Yes.
For sure, for sure?
Yes.
You know you have to use it for sure, for sure? You know it's negligent if you don't use it for sure, for sure? Okay, all right. So you don't need any fancy equipment to charge labor. You have a photograph. It was made for Africa. When I studied midwifery in England, that's what I used. That's what they had. We didn't have no monitor, right? So stop people talking, what monitor? Use the photograph, right? Mothers arrive without antenatal care. Have you ever seen any of those? They just show up, ready to deliver, right? They come all the time, right? That's a problem, but they come all the time. Part of the reason they come is that one, they've given birth to many. They know how this thing runs, so they don't need anything. They're fine. They self-monitor themselves, and you're like, oh hell, you're in full-blown eclampsia, right? You just made it, and oh, you're having triplets. You know what I mean? They're just coming. Listen, beloved, this is not the time to tell them off, right? So we're going to act as if she always came, and then when it's over, we're going to say, listen, I got to talk to you. You see baby number 5? If you don't come and I hear that you're pregnant, I'm coming to get you, right? Because you can't keep going through this. That's how mothers die, right? But this is not the time to tell her off. Because when she comes and see everybody running around, she is beginning to think, oh, I messed up this time. She knows. No mother wants to deliver a dead baby. So panic is beginning to set in. So when you see the blood pressure, don't show it to her. So you see this? Don't look panic. You're going to keep smiling, you hear? And you're like, dear God Almighty. But you're going to smile, right? I know how to smile. I'm a criminal defense attorney, right? And the state attorney just put a witness on and said, how do you know he shot the person? And said, ma'am, I was there. I said, don't shoot, and he shot. And this is me. That's okay. We're going to roll with this. You had a gallon of Jack Daniels before you said that, didn't you? So we know how to mask it. You feel it and you're like, Oh dear. I was in somebody's home recently in the backyard, and we have music once a month when it's cool. Beautiful music. And I saw one person kind of lean and looked at a gentleman sitting in a chair. And there was a slight, my nursing kicked in, I thought that her eyes looked concerned. And his posture, I'm like, that doesn't look like he's leaning to talk to her. Look like something is wrong. I go up to touch the man, and he's as cold as whatever, and he's diaphoretic, like, and I'm like, no. I don't remember what they said when I was in, it's a long time I practiced nursing. I don't know, but this man is going down, right? So I didn't want to alarm everybody. I'm like, oh, please put him on the, please put him on the ground, and you please call 911. And the least I could do was to control my panic, because I'm like, I don't even remember how to do CPR anymore. I know they changed it last year. What did they say? Something about not you having to do mouth to mouth, and something you have to go deep enough to break the sternum. What did they say? Oh, I'm smiling, right? So got him down, and got him, pour some ice on him because we were outside, lift his leg. And then it occurred to me, you don't want to check his pulse? You check his pulse. And I'm like, I don't think he has a pulse. So I'm like, no. Put his legs down because I'm going to have to do CPR now. A gentleman came by, and I said, are you a doctor? Because I need to pass this man off. And he says, no, I'm a paramedic. And I said, check his pulse. And he looked, we didn't alarm anybody. He looked at me and says, just shook his head. I know we had no pulse. So we started, and he got revived and stuff like that. And like, Jesus, please, don't do that again, man. I mean, I don't remember some of these things, and I could have killed you trying to save you. Don't remember, But the point of it is, we know how to mask our look. The patients know. You go to the doctor as a regular person, God forbid, and your mammogram, you're watching them with this mammogram thing, and you notice that it starts with a tech. You're taking more, and they're taking more, and you're like, what's wrong? What's going on? What's going on? And then they get on the phone, and somebody else comes, and they're not talking to you, and they're looking, and you have died 1,000 deaths, right? Because you're like, I knew it. My mother died of cancer, breast cancer. My daddy died of breast cancer, one of the few men in the world to die from breast cancer. My granny died of this cancer. You see it now? I have it now. And if you don't mind, you start bawling. And then she says, what are you crying about? No. You just have dense breasts. And I was trying to figure a way how to visualize it. And she is the person I call is the queen of taking mammogram with dense breasts. And you're like, dear God, why didn't you tell me this before? Because you've already figured who you're going to put in your will, who you're going to take out of your will. Because you're reading what's happening around us. It's the same thing when things are happening with the mother. They're going to read your face and your action. It doesn't mean that you're not going to move fast. It's not going to mean that you're not going to be serious. The baby comes out, the baby's not breathing. You're like, this baby ain't going to breathe until we get them to the NICU. You don't, the mother's going all the time, what happened to my baby? What happened to my baby? They know, they can sense. You be efficient, you be calm, you don't lie and tell them, your baby is whatever you might say, there's a little bit of problem, we're going to fix it. Because you just got a dead baby. That baby came with dead. If you tell that lady something that is so off the wall, you're never going to recover. Because she's going to tell everybody in her village not to come to the hospital. Don't trust the hospital. Because not only is she going to tell them not to come because you lied to them, they're going to tell them you killed her baby because you told her that the baby was okay. And you're looking at a dead baby, right? And now you go tell her the baby is dead. What do you think she's going to think? You killed the baby, right? So be careful with your words. Use compassion. And let me explain something to you about people who have fetal demise. You have to find a place to put them away from people who are giving birth to very live, happy baby, and everybody is laughing and crying. And she is in the ward in the middle of all that and her baby is dead. Don't do it. Do not do it. She needs special care. That is why, if you're in charge person, you know some nurses have more compassion than everybody else. Assign that person to them. That is her job. She is good. She cannot deliver anybody for a squat. She don't know when it's time to give an episiotomy. The woman will have a rip to the rectum. That's not her thing. But compassion, that's her thing. Assign her that baby. When I was working in the medical intensive care in one of the hospitals, there was a lady. Name was Yamilet. She had more compassion than everybody in ICU, and she'd be like massaging the patient. I'm like, girl, your patient is dying. Look at the monitor. But she's there, compassion. So everybody needs a Yamlet. Let her take care of that mother. This is a special case. We drop the ball all the time in that arena. And it's not because we're not kind or compassionate. We don't have any space. Talk to your hospital. What do we do? How quickly, if anything, we can get her in and out and go home, away from all of this? We have to follow up with them too when they go home. They leave their visit pregnant, they come back without a baby. Yeah, it's not cool, right? So we have to find some way of following up with them. How they doing? Even call their pastor. Find a system around them, and church is good. Say, pastor, first of all, ask her if there's anybody. Maybe she doesn't have anybody, right? And if not, figure out and say to her, you go to church? Because don't call the pastor until the pastor the woman has a dead baby, and then the woman don't want nobody to know. She's not ready, right? So is it okay for me to call your pastor? And then do it, right? They will take care of it. They know how to do that well. They're in that business of compassion, right? So, understaffed and limited support. That is every day. In every hospital, some more than other. Grief. We talk a lot about pregnancy and midwifery, because most of you here are. But this applies to every patient. Every patient that comes to your hospital. And hospital is a stressful place. That's because we deal with sick people. There's nothing fun or joyous. Midwifery is the happiest place if everything goes well, right? But the hospital, you have to understand that regardless of what's happening to the patient, surgery, a little bit of pneumonia, whatever it is, skin problem, you have to be compassionate to your patient. All right, next slide, please. So we talk about sit with the mother. Use soft words. Words matter. Don't use cliches, jargon. Don't tell the mother that Jesus says everything's going to be all right. That's not the place or the time, right? So use soft words. Say the baby's name. If she has named the child, say the baby's name, right? If the baby has passed, find out, did you name the baby? I know in a lot of countries the baby doesn't get named for a long, long time because they don't survive, or sometimes people think it's bad omen. Whatever the culture is, that's what you follow. But if it's a situation, say the baby's name and allow for grief and allow support. You cannot tell a mother with a fetal demise how long to grieve. She might grieve forever. She might have other children and she's still grieving. A loss of a child is a loss of a child. A death is a death. And grief is gluttonous. A friend of mine wrote that grief is gluttonous. And it will take hold of you and you again and won't let you go. That is grief. And you cannot compare how people cope with grief, right? Let her grieve. If she's not pulling out of it, get her support. But it's not to tell her to get on with her life and she has other children that she has. That is not the conversation that needs to take place, right? Please. We talked about touching, about hands on the shoulder, use your voice in a calm way, present. And it's some people just have a calm voice. They relax you in the midst of the storm, right? The nurse with a calm voice assigned to those kinds of things. You know, focus on the present, keep her safe, reassure her if things are uncertain, and never judge. We judge our patients too much. Every person has a story, including us. Every mother has a story, and it's uniquely hers. Do not judge. Be free from judgment. Be impeccable with your words. Words matter. It can either reassure or it can cut a person down, right? So do not yell at your patient. Because the more you yell, the more they're going to yell, right? And you'll find that you lose control. So as they yell, you go down. And you be psychologically, so will they. It's all psychology here, you know, or let them breathe. Take a breath. Okay. Every patient deserves dignity. Honor the culture and give them privacy. I know we have wards, open wards, but the worst thing is to not give people privacy, even though you have to deliver them and you have to take off, give privacy. And don't forget the women with female genital mutilation, right? You guys, they perhaps don't want anybody to know. Now they know. They got it when they were 3. Now they know that that's not the culture we live in. You're going to see them. They're going to come from some region, Upper Volta and all those ethnic groups. This is not the time to say, my God, they're still doing it where you come from. No. I saw one when I was in England. She was from, I think, Sudan. And my thing was, I saw one. I thought everything was nice and shiny. I didn't know where it went. Okay. All right, sir. All right. Keep going. All right. So you have to go out in the community and talk to people. If people don't know you, right? Especially like say you go to church, you know they're coming to your hospital. There's only one hospital, they're coming to you. Develop a relationship before they arrive there, right? Let them know that you're always there. If they come and they're having a problem, ask for nurse, midwife, so-and-so, like that. That is essentially where we are. Now, I wrote a little piece for you guys. And I don't know it by heart. I just wrote it, so I'm going to read it. Is that okay? And I need the glasses too. And then you all going to talk to me. It says, to the brave hands that catch life, to the nurses and midwife working in the clinic, tucked behind dusty roads, village path, in hospital where the power flickers and supply run thin. We see you. We honor you. We thank you. Even when the toils are missing, you are there. Even when the roads are long and the nights even longer, you're there. You rise with the sun and sometimes do not sleep before the next. You show up not just with your skill, but with your heart. And that is what saves lives. You're the lifeline for mothers who walk miles to be seen. You're the voice of calm in rooms filled with pain and hope. You're not just caregivers, you're warriors of compassion. Your work is sacred. Your calling powerful. Though the world might not always see the quiet miracle you perform, we see you. We're lifting you up. Please do not forget you're not alone. This is a world of people standing behind you, grateful for your courage, working towards better support, more resources, more justice for you and the women you serve. So today, take a breath, take your hands on your heart, and remember this: you are light. You're the light that will never be forgotten. With deep respect and unwavering gratitude, my company, Desert Sage, and myself, Lorna Owens. And one more thing. Put your right hand over left shoulder. From me to you. Blessings. Now, time for questions. You can stop now. Time for questions. And tell me what's going on.
Before that, I want us to say a very big thank you to